Deductibles, co-insurance, out-of-pocket expenses. Oh, it just all sounds so confusing, right? Stick around and I'll give you 3 easy ways to remember them so that you can be on point when it comes to your benefits.
Turn it up, gang time.
Real homies.
Real homies.
Real homies wanna know.
Real homies want to know.
Real homies wanna know.
Real homies want to know. What's up, homie? Welcome back to another episode of Real Homies Wanna Know. If you're new here, my name is Christina, creator of Gero-what, a page for anyone at any age. Today, we're going to be covering something super important, especially if you are trying to level up your health game. Health literacy. I'll make this real simple. Health literacy is basically being able to understand health information so that you are able to make smart decisions about your health in your life. So that means understanding prescriptions, understanding what your doctor is telling you, and being able to navigate this wild world of health insurance. But here's the dope thing. You ain't gotta go to school to be health literate. And by the end of this video, you're gonna be one step closer, if not already, health literate. Alright? It's a skill, and we can get better and better by asking more questions and making sure that we really understand what's really going on when it comes to our health and health insurance. Speaking about health insurance, let's go ahead and cover that next. I know, that is not the most fun topic to learn about, but listen, understanding this will have a major impact on your life as you get older. I have met so many different people who see health insurance as this big headache, and trust me, it can be when you don't understand it. But listen, I was in the health insurance field for 7 years, so you know I got the cheat codes for you, and since you my homie and sharing is caring, I got you. So let's break down all these different terms that come up regarding health insurance. Premium, deductible, co-insurance, and out-of-pocket max. Now let me just say, when it comes to health insurance, people typically either purchase it through their employer, or if you're unemployed or an entrepreneur, you might just purchase it directly through an insurance company. But either way, they have set benefits that they offer. When you go through your employer, they may select specific benefits that they want their employees to have. Mental health benefits, chiropractic benefits, massage therapy, physical therapy. These are all things that your employer will select for you to be able to have the opportunity to use those benefits. The private insurance company that you might go directly through, they got their own plans that you can select too. So I just wanted to make that clear. A lot of times the benefits you have access to, especially if you're going through your employer selected it. They call it like a customized plan that the employer purchases and then offers for you, okay? Now, the premium. The premium is the amount that you pay for your health insurance. And typically it's like a monthly price that you're paying. So think about this like how you pay for Netflix subscriptions or your gym membership. And let me tell you, the higher the premium, meaning the more you pay for that insurance plan, your benefits are gonna be chef's kiss, okay? Now, the less you pay for them benefits, they not gonna really be the chef's kiss thing. They might be alright. Like, you could be like, did you just learn to cook this? It tastes okay. Or you might be like, yo, this is garbage. Throw it away right now. I don't know. It just all depends. But I just want to throw that out there because a lot of times we, the consumer, are trying to figure out how can I save money? How can I keep from having so much money come out of my check? And so we look at that low premium amount and we like, oh, well, I'm doing that right there. And then you get it and the benefits that come with it, like the deductible, the co-insurance, terms we're going to go over are not that good. But if you pay a little extra, then you might be more pleased. So what I want you to get from all that I just said is You can either pay a lot now or you can pay a lot later. But either way, the money gonna come out. All right. Now, let's talk about deductibles, okay? This is the amount you have to pay for services like your health services, going to the doctor, getting a prescription filled, going to a chiropractor, whatever you do, right? You have to meet a deductible before your health insurance will kick in and start making payments on the services. So let me break that down a little bit. All right, we're gonna do a little example. All right, so imagine it's the start of the year. Happy New Year, right? And so everything's starting from scratch. And you have a $200 deductible. Right now, nothing has gone towards that deductible. You haven't had any services or anything because it's the start of the year. Now you done caught a cold. You know how it is. The seasons change. It's cold outside. You achoo, and now you gotta go to the doctor. So you go to the doctor sees you for your cold, and the doctor charges you $100 for that visit because you know them visits don't be cheap. Later, you get something in the mail called an explanation of benefits, and it says you owe the full $100. You like, what? What good is my insurance then? Why they not paying nothing? I'm paying them all this money and they ain't even paying nothing. That's because ain't nothing going towards that $200 deductible yet. So after the visit, you done paid and everything. Your insurance already calculates it. They don't never know that you paid it or not, but their system has added that $100 that was your patient responsibility towards the $200. So now you only got $100 more left before you meet your $200 deductible for the year. As you get more services, what you owe goes towards that $200 deductible until it has actually been satisfied or met. After that, your insurance starts picking up a bigger chunk of the bill, which leads us to the next term, coinsurance. Now, I don't know why this term is this term because it almost sounds like there's another insurance involved. But think of it like a pilot and a co-pilot. The pilot really doing all the stuff, right? But they got the co-pilot off to the side doing a little something too. Think of the insurance company as your pilot, your insurance, and you are the co-pilot, the co-insurance. So once you've met your deductible, now the coinsurance kicks in, which means say you've got a benefit for physical therapy. And that benefit says that when you have met your $200 deductible, the insurance will pay, and your coinsurance, your responsibility is 20%, right? So it's like you and the insurance company kind of splitting the cost, okay? So let's do another example. So you go to the physical therapist, they're treating your shoulder, and the services are $100. Your insurance would pay 80%, so $80, and then your responsibility would be the 20%, $20. That's how it would work. Now that leads us to the out-of-pocket maximum. So think of this as like your safety net. This is the most you will have to pay out of pocket for the year before your insurance is going to kick in at 100%. So it's like, move, co-pilot. I don't need you no more. I got this. Let me just fly the plane the rest of the time, okay? So every insurance has a limit to how much you as the insured pays before they pay at 100%. So say your particular plan says your out-of-pocket max is $1,000. This means that once you've paid $1,000 out of pocket through deductibles, coinsurance, or co-pays, which we're not gonna cover, but it's basically like a flat rate that you pay. Once you've paid out of pocket for all, based off of whatever those expenses were, now the insurance company is going to pay 100% of the cost for the rest of the year. Example, if you had a service that costs about $500, but you've met your $1,000 out of pocket, you don't have to worry about paying that. Your insurance would pay that at 100%. But here's a little kicker that I want you to keep in mind. You know how there's always like small writing or there's always specific wording? This is that kind of thing. So a lot of insurance plans will say 100% of eligible expenses or 80% of eligible expenses. That eligible, boo-boo, that's gonna be the kicker, because eligible means your insurance plan said, oh yeah, we'll cover that. But if it's not a covered service under your insurance plan, they not gonna pay for it, and it's all gonna fall on you. So here's a little cheat code. Say your doctor says, hey, we want to run a test, and they schedule the appointment for you, and you know you're about to have this service. Before you have the service done, ask the doctor's office, hey, what code do y'all use for that service? Get the code that they use, what they use to bill the insurance company. Call your insurance company and be like, I'm about to have this service done. Can I give you this code and you let me know if it's covered under my plan? Give them that code. They can look it up and let you know if that insurance company even covers it or not. That way, you're in the know and you don't have no surprises later on like, oh, my doctor said I could get this test and I just did what my doctor said and now I have this huge $1,500 bill because I didn't know. That is a way to be in the know. So jot that little secret down. So we've covered 4 terms: premium, deductible, coinsurance, and out-of-pocket max. And here's a bonus: in-network and out-of-network. So let me just break that down really quickly. In-network means your insurance is rocking with them. All right? They real cool with each other. It's like, yeah, you my homies. And so what that means is when you see a provider who's in-network, meaning they have a contract with your insurance company, and you get a better benefit. But if they not really rocking with your insurance company like that, they're considered out of network, meaning they not like us, okay? You not in our club because you didn't want to rock with us like that. And because of that, the benefits are going to be lower. So maybe when you meet your deductible, the benefit is we'll pay 60% of eligible expenses and you'll be responsible for 40%. Ooh, so it gets a little nasty, all right? So always try to see doctors who are in network. But look, there are some times that you're just going to really like a doctor or other healthcare professional that may not be in network, and you'll just kind of eat that and be like, listen, I'll pay the extra cost. Comment and let me know, did it make sense? Do you want more examples? Because I'll give them to you, all right? That's one component to being health literate. Understanding the different terms related to health insurance. So that's all I got for you today. I'm going to see you back here next Wednesday. Make sure, if you haven't already, subscribe to my YouTube channel and click that little bell so you can be notified when I drop new content. In the meantime, in between time, you be blessed. And thank you so much for watching. Bye.